Hello, everybody, and welcome to the show. I'm very excited today because I have a family of pharmacists with me. And this is a first on the show. I didn't think I would be able to say that, but I'm very happy to say that today. We have John Noriega and we have Basil Noriega. They are the owner of Bill's Prescription Center, which, like me, I'm quite sure you're going to have a question as to why it is called Bill's Prescription Center when I'm talking to Basil and John. So with that, John, you want to jump in and tell the audience the story of Bill's Prescription Center?
Sure. Glad to be on TV with you. Bill's Prescription Center was thought of with by my mother and my dad. My dad's name is Bill Justo Noriega. Opened in 1956 in Brandon, and he started with $3,000, $1,500 for fixtures that him and his father, my grandfather, built, and $1,500 of inventory money. And from that, we've now grown to another location, and we have one pharmacy, Bill's Prescription Center, that's located at 202 East Brandon Boulevard, that's run by me, my sister, Basil, and our other host of great customer service pharmacists that as our team.
So I understand that you are the 18th business to open in Brandon. Is that correct?
That's correct. If they're giving you that data, I think that it might be probably the 10th. But the interesting thing that's nice to know about that is that we're still the family-owned pharmacy that was opened in 1956 and still owned by the same family. All those other 10 or 18 businesses, I believe, no longer exist, which makes it very important that we're kind of a historic site.
Yes, you are a historic site, and it is refreshing to hear that a business has stayed around since 1956. We certainly don't hear that story enough. So thank you for all you do. I would like for you all now to meet Basil Noriega. Say hello.
How are you? Thanks for having us on.
Thank you. In New York, we say, how are you?
How you doing?
There you go. Well, you did go to school in New York, so you've heard a lot of that, correct?
Picked up a little of that, yeah, over at Fordham.
And then you quickly were forced to lose it when you got back to Florida, I'm sure.
That's right, yeah, you had to readapt.
So my fascination is that you all are a family-owned business, and so you all work together. I want to first hear about what it's like working together as a family, and I'm going to start with you, Basil.
Okay.
And remember, we don't lie on this show because lying is the devil.
I'll be brutally honest. I mean, I grew up at the pharmacy. I was a baby there, and I also was a troublemaker there growing up as a teenager. And I worked a lot of customer service, and my grandfather would get on to me sometimes and basically teach me some of the values that I hold today about the patient's number one. And back then I saw them as customers. I didn't even think the idea of patient pharmacist relationship or a patient customer service relationship where it's more than just a person coming buying a product. They're coming and actually getting a medical advice or actually talking to the pharmacist they see as a friend or a brother to them. So it's something pretty unique that that I got growing up, and then now see every day working at our store. Go ahead.
So let's clear up some of the human naivete. Basil, you went to college.
Yep.
You did your undergrad.
That's right. I did my undergrad at Fordham.
So you know a thing or two about medicine, yes?
Oh yeah, definitely.
You're a doctor of pharmacy.
That's correct. I got that from University of Florida.
Beautiful. So I'm going to tell you some of the myths of the humans out there that you might be unaware of. Ready?
Okay.
You're a pharmacist, you're not a doctor. The hell do you know? Have you
Heard
heard
that
that?
before.
Yeah, you've heard that.
Oh
Okay.
yeah.
All right. My doctor told me I need this, and you're telling me that this isn't correct. Have you heard that before?
Oh yeah.
Okay, good. We just want to make sure we're on the same page here. There
Mhm.
are a lot of misconceptions, I believe, in the pharmacist world. Corporate pharmacy, privately held pharmacy is vastly different. And that's really what I want to get to today. But I want to make sure that everybody understands that's listening or watching the level of education that you have and the understanding of the patient's needs is a priority for you, correct?
Correct.
Basil, do you want to just elaborate a little bit more on, because I really want people to get a sense of what it's like when they go into a pharmacy, they're relying on you to dispense their medication. They really just are like, it's the doctor, it's the doctor. Where do you fit in that like medical connection there between the physician and the patient?
Yeah. I think a big misconception a lot of people have, especially on the surface, is they think a pharmacy might be a place that's just a service that's just dispensing something, where they get a piece of paper that tells the pharmacist the counts of pills, they put it in the bottle, and then they hand it to the patient. And there's a lot more that goes into that. I mean, the idea that that's even there is probably because a lot of corporate, where people are shuffled in, shuffled out. It's a quick turnover business. But either way, some of the things that you see there from a pharmacist's perspective is that you're getting patients coming in to see the pharmacy and to come and get the refills much more often than they are seeing their doctors. So we're that point of contact where, if there is an issue with therapy or if there is an issue with the patient's medication adherence, we're able to see that patient more often and have more of a chance to catch it and to have that discussion with the patient. I think that's one of the biggest roles that a pharmacist can play is not just looking at that medication and making sure it fits in that patient's medication regimen or with their other disease states, but also the fact that we're making sure that they're able to be adherent and properly taking what they have been prescribed.
Mm. So thank you for that. Well, I want to know why neighborhood pharmacies are disappearing today. John, can you address that?
Sure. There's several reasons. Attrition may be one. As an older pharmacist, I'm the older pharmacist now. My father was the older pharmacist when I first became a pharmacist. And today, we know most people are, when you talk about information and what we have for information for patients is basically in our business, it's unlimited amount of information that we are able to gather. When we're filling prescriptions today, as opposed to 1975, 1960, you have an entity called Pharmacy Benefit Manager. And the Pharmacy Benefit Manager, the original Pharmacy Benefit Manager was opened in 1968, and they were called PCS, Pharmaceutical Card Service. And what they basically did is just adjudicate claims. They were just a computer program that just adjudicated claims, and now they've become basically the entity that's the go-between between the doctor, the insurance company, the pharmacist, and the patient. And that entity has now become very viable. As a matter of fact, there in the early 70s, there was probably 24 or 30 of those pharmacy benefit managers. Today, there's 4. So they've had vertical integrations where what we now have is a monopoly basically on prescription transactions. And the answer is is complex because when you used to come into a pharmacy, you give a prescription, the doctor wrote you a prescription, you went to the doctor and spent the time there, and then you hand in your prescription card or your insurance card, and the pharmacist or the pharmacy technician comes out and says, "Oh well, Mrs. So-and-so, your prescription service says that your prescription needs a prior authorization." Well, we didn't coin the phrase prior authorizations. The
It's
pharmacy
not
benefit
your
manager.
fault.
Pardon me?
It's not your fault.
Yeah, we didn't coin that phrase, but we have pharmacy benefit managers who have basically inserted themselves as a leech on our business that tells us that this is what you're going to tell the patient, and don't tell them anything else, and then send the information to the doctor, and the doctor decides to confirm his original prescription, which sometimes he does and sometimes he doesn't. Then we might think about paying for it. So I guess the long story of it is that pharmacy benefit managers are the entity that's causing entities like independent pharmacists to go out of business. They're owned by our competitor. CVS Caremark is a competitive company, so they're paying us to fill prescriptions. So we're kind of like a sitting duck for that type of entity. Luckily, when you have a facility like ours that we handle more than just filling single prescriptions, we take care of people who are at home, who are homebound, children that need specialty drugs that they can't find anywhere else, or if they can, they can't get delivered to them at a reasonable time. So a lot of nurses and doctors do depend on our practice to continue taking care of those patients.
So they're brokers.
Correct.
Well, that sounds a little suspicious. Even to me, who's been in the medical industry for over 20 years, just a little bit.
Well, medical managers, I think, also oversee physicians' offices. Their medical manager is very similar to a pharmacy benefit manager. They're the ones that tell you have to see a patient, you have to have your arrangement of your examining rooms in a certain way so you can get in 30 seconds and out in 40 seconds, and you can get to the next room in 20 seconds. It's on
The old treat 'em and street 'em.
There you go.
There you go. Okay, well, this is disturbing. Let's talk to you now, Basil, about SPAR. What does SPAR stand for?
So SPAR is basically a organization in the state of Florida that is trying to advocate against or advocate for independent pharmacies against pharmacy benefit managers. They have quite a few resources on their site that allow not just pharmacies, but the patients themselves or doctors to go on and petition against what's going on and really open up an avenue for transparency to these pharmacy benefit managers. The biggest issue that we're seeing with them is not just the reimbursements to pharmacies, but also the dealings that they have with these actual pharmaceutical companies by getting a kickback. So they increase the rates of what the medications cost. And there was a big lawsuit with EpiPens about that showed some transparency about what's going on. But yeah, it is a pretty big issue that we're seeing that is putting independent pharmacies out of business because of.
So most of my docs that I work with through the years use compounding pharmacies such as yours. So why don't we tell the audience what a compounding pharmacy really is? What does that even mean, John?
The compounding pharmacy, or what we will offer, is when specialty type formulations need to be prepared that are specifically formulated for that individual patient, whether it's hormone replacement or if it's testosterone replacement for a male or a female. Depending on what their levels are, we're actually picking the exact concentration or close to the exact concentration that needs to be replaced in their body. For other situations, we have children that have respiratory conditions that give them a lot of secretions in their lungs, and so we prepare glycopyrrolate solutions for them so that they can absorb that, and then it reduces the amount of mucus or phlegm that's in their lungs so they can breathe properly. So it's basically designed for preparations that aren't available on the market, that are basically set to the standards for that particular patient. That's how a compounding pharmacy operates, through a relationship with the physician and the patient.
Right. And a majority of my docs are involved in bioidentical hormones, hence why they have to use a neighborhood pharmacy such as yours, because you are able and can easily take care of these needs that you wouldn't typically get through the big entities. So you told me a great story before we hit record today about a delivery. I want everybody to know that John delivers medication to your house if you need it. Actually, maybe just in these uncertain times of COVID-19. Why don't you tell everybody that story that you told me before about that patient that needed that medication?
The patient that needed the ophthalmic antifungal, that was a specialty item that it's a manufactured item, but not a lot of pharmacies carry it. So this particular physician that was out of Newport Richey, the physician's office called our store. It was probably 4:30, 5 o'clock on a Friday afternoon, and the question was, did we have an item called Natacin? And the answer is yes, we did. I was lucky enough to answer the phone when they called, and I asked the nurse that was calling. I said, there's a lot of stores between Newport Richey and Hillsborough County. She said, I've called every store. No one has the product. So, and the patient needs to start on it tonight. I said, well, I won't be able to get it to her in an hour or so, but I'll get it to her that she'll get her first drop in her eye before she goes to sleep. And that's what we did. We went to Newport Richey, and unfortunately all the restaurants were closed, so I couldn't have lunch or dinner after I delivered it, but it worked out all right for the patient.
Well, I love that story because I do think that there's nothing wrong with some good karma today by doing something for the patient, going the extra mile. That to me is the epitome of hospitality in healthcare, and we need certainly more of that. It reminds me of the story that I read about your, was it your grandfather that he accepted eggs and vegetables in exchange?
That would be Basil, yes. That was my father.
Mm.
You're talking about hospitality and going the extra mile and 24-hour pharmacies. My father, Bill, when the store was early, obviously, the phone that rang at the store, which was 689-352, on the same phone number, it would ring at our home, which was kind of maybe a couple of blocks away. So that if the phone rang and we were closed, my dad would actually answer the phone at home and answer at Bill's prescription center. And it was usually either a doctor or a patient that knew him. And when my dad would go there, if it's 2 or 3 o'clock in the morning, he would fill their prescription, because he basically it was a 24-hour store, because it was always, the phone rang as if it was the store that was open. So,
but there's no more exchange for eggs and a vegetable anymore, correct? I want to make that clear.
Well, we do, but sometimes, honestly, sometimes people don't have money and they have something of value, and we will accept that as payment.
That's
or if they don't have money and they need medicine and we have it, what is it on the shelf for us to help people? So we're going to make sure that they receive it.
Oh my God, I'm loving you guys more and more. Okay, so I had to go and buy a thermometer recently, last Wednesday. Now, thermometers, if anybody knows, or maybe you don't know, they're a hot commodity right now. They're like toilet paper back in March, right? So I went in to the local pharmacy and they were out, but they told me that the shipment was coming at 3 o'clock, and I just didn't have the time. I needed to know ASAP. So I went to my neighborhood pharmacy, which I will go to more now, and they had thermometers. Now, they only had the fancy, digital ones, but I would have paid whatever they were charging because I needed that thermometer. So what's going on now with COVID-19? How has it been? I know that you've been affected, your business. I know that things are vastly different, and I'm quite sure that you guys have had to readjust. I'm trying desperately not to use the word pivot anymore, because all of these business terms are really getting exhausting. But Basil, maybe you could speak a little bit to what it's been like since March for your business.
Well, I mean, I wish there was a roadmap of exactly what to do right off the bat. So it was definitely a lot of trial and error, trying to figure out how to keep our patients safe, how to keep our staff safe, how to limit spread. It started with making sure we got plexiglass, sneeze guards put up around the registers to protect the patients, protect ourselves. And then at one point when we were at full lockdown in the area, we had done curbside only. Nobody would come into the store. And then as things started getting lifted, we allowed people to come in, but we started a one-way path through the store and made sure everybody was distanced as they were inside. Now, obviously, wearing masks is a huge way to limit the spread. So we're all, masked up and constantly cleaning between patients, which we've been doing from the beginning, but even more so now, making sure everything is as clean as possible. So, I mean, not just in the store, but also ordering has changed. The availability of products is sporadic, and what is available that's from other distributors has been gouged. The prices has gone from a few dollars for some masks to $40 to $50 for some masks. So it's scary to see how people are taking advantage of the situation, but it's also scary to see that there's medical supplies that are limited for people that actually need them, and healthcare practitioners that actually need them. So hopefully we see some changes pretty soon as far as the supply line goes.
Well, I will tell you, when I walked into the neighborhood pharmacy, the first thing I saw was a thermometer, alcohol wipes, gloves, Lysol, and I felt like I walked into a place called "These are a few of my favorite things." Right? It was like
exactly what you walked in for.
Oh my goodness. It was wonderful. And I just took everything from the shelf. I didn't care what anything cost, because really there's such a demand for these necessary supplies now, supplies that we never thought we would need as much as we do today. How many employees do you guys have, John?
We have 32.
Woohoo! Okay, you shocked me a little bit with that number. That's a nice little number. So how has it been going with the staff? What is because this is a lot about the business of medicine. I told you guys before that I decided to start doing this show because I had this great network of people that they're healers, and we want to provide support and help to our community. And I have a big love for employees, and I'm always curious as to what the communication was like with staff while this was going on.
The staff, well, we first of all, we handle our employees just like if they're part of our family. So we're the most important part of our business is the patient, but the next most important part is our employees, because they're the ones that are helping us serve those patients. And and I think that it's a give and take with us, because I don't own the store. I work there as an employee when I'm at work. I don't look at it as I'm going to tell you what to do. I'm going to actually help you do what we need to carry out this mission. Our mission is to take care of people. So if my customer service team looks a little stressed and looks a little overworked, and they're having to run outside to the curb service and then run back in, and then there's a question that has to be answered, I try to get in there and try to offer some help to let them know that I'm really on their team. I'm not saying it, my actions I want to show that with my actions. And that's with the COVID situation, that to me was very it was overwhelming, first of all, because no one really understood what was happening. And we still really don't know what's happening, except that we at least have some guidelines, and it's kind of calmed down a little bit because we've allowed people to come in the store. But the employee and and relationship that we have is we're very lucky. I consider myself blessed to have the employees that we have, and blessed to have my son there, blessed to have all the opportunities that were afforded to me and being afforded to him. And it's very it's a self-rewarding practice is what it is.
Mm. Well, I bring that up mostly because I have a very strong passion for mental health, and I had dedicated the whole month of July, lucky you guys, to make sure that every show I'm having this conversation. And while you were talking, I remembered this this show on Netflix about a pharmacist that like almost cracked the opioid issue in his. But do you know what I'm talking about? What's the name of that one?
That's a good one. I think it's just called The Pharmacist.
Oh my God! Everybody should watch this show.
Yeah.
Like, thank God for people like him. So because there's such a high level of anxiety and confusion, I'm so glad, John, to hear that you are communicating, most importantly, with the staff. I think that that's certainly been lacking in a lot of companies, not having open conversations. Luckily for us, when you have a privately held business, you can really treat your employees like family. And I think that that makes such a difference with people coming into work. They just feel supported. Have all of your employees felt, not your employees, I'm sorry. That's not what I want to ask you. I want to ask you actually, have you seen an uptake of medication in terms of helping people with their psychiatric needs? Throwing this one out of left field, so right to you, Basil.
Yeah. I have had a lot of patients asking questions, and I've noticed that, it's hard to find a patient that they say, oh, I'm very tense because of what's going on right now. I've gotten this medication prescribed because of it. I haven't had any patients that have directly said it, but I've had patients that have asked. They've wondered which medications cause or for their anxiety. They've called and said, what are the kind of things that a doctor could maybe I can talk to a doctor about that would help me with depression or tension. I've had those conversations with quite a few patients, more so now than before all this was going on. So, I mean, it definitely is a point of contention or a point of frustration for a lot of people because their social interactions have changed. The dynamic of them being able to go out and do what they want to do has changed. So, and even just the amped up tension that you can hear in certain people's voices when they come in about not having something or wanting to, why isn't my medication here yet? Because they're waiting for the doctor to send it over from the office, and there's a little bit more amped up tension because of that. Because some people, they want to get in, get out as quick as possible because they're afraid that, it's going to come and get them, whatever's out there. Well, obviously we don't know what's out there, but.
So you guys become like a resource for like where people can go. All right, let me set it up like this. When I ran pediatrics for 8 years, we had this list. Oh, this list was such a horrible list. We had hanging up near our triage section where the nurses were, and it had a list of doctors' names, primary care, specialists, ophthalmologists, surgeons, psychiatrists, psychologists. The practice itself, when I left, was 50 years old when I left. So I love the whole generational and grandparents and, their grandkids coming in. That's what I came from before I opened my business. But this list was so antiquated. It was worse than an insurance list, So what do you guys have a special report and a special network? Because I know people are always looking, they were always looking to us as a primary care type practice of where to go. I would assume that your patients get real comfortable with you, John, and want to know who you would recommend. Could you talk to me about that?
That's pretty commonplace for us to recommend a primary care doctor or an ophthalmologist, pediatrician, one or two pediatricians. You don't want to get the other too many pediatricians upset with you, so you have a list of 2 or 3. Even they want to know where you get your car serviced, or where do you have who does painting, and what it's almost like a referral service because way back when gas station used to be, how do you get to a certain location? They would give you the directions. Today we have navigation. We don't need that. But our pharmacy has a wealth of, we have plenty of employees, and we have plenty of resources to help patients understand who to see for orthopedist, or or a psychiatrist, or a chiropractor, or a whole host of
Anybody.
different practices.
Do you get to meet them a lot? Do they come in to visit you? Do the docs come? I'm asking, but I already know the answer. Do the doctors come to visit you?
Sometimes they come in because we're friends. Sometimes they come in because they use us as a pharmacy. So we're that category that people not only refer to us as Bills, but they also come to us for Bills and for what Bills can offer them.
That's awesome. Well, before we lose everybody's attention, because the attention span is about to flee today in 2020, is there anything else that you want the audience to know about your amazing business that is just, I don't know, 1956 is when you opened?
1950. Well, we opened in 1956. I wasn't unborn yet, but I was just a twinkle, like they would say, oh, you're just a twinkle in your dad's eyes or a twinkle in your mom's eyes. I've never understood that, but that's a twinkler.
You certainly kept it going, and it's really kind of wonderful that you did keep it going. Well,
I will say this though. You asked if what we would like to say about our business.
Please.
Is that you should try us and call our phone number or call my cell number, and you see what response you receive. And when you are pleasantly surprised with what you receive when you call our numbers, then you'll be sold.
Does a human answer the telephone?
Yes. There's no answering service.
No.
I get a lot of flack for that, but it's really important.
I wonder where that flack is coming from. It's the youngins.
It's my dad. It's not, I shouldn't say flack. I should just say, when I was a young pharmacist, there was a lot of thoughts I had back then that I now understand why I needed to change them.
Yeah. So I could call and I can get you on the phone. That's awesome. I love that. I think that you guys are awesome. I'm going to tell everybody about you. We're going to have all your contact information. I know you do a lot for the community. Basil, I know that you have a special interest in mind for the community. You're involved in some charitable organizations. Why don't you tell the audience about that before we go?
Well, I mean, besides just donating and helping out local charities and schools, one of my pharmacy friends who I went to pharmacy school with, he has cystic fibrosis, and he attends a cystic fibrosis walk every year. Unfortunately, because everything that's going on this year, they're not able to do the walk. So, definitely keep them in mind. The Cystic Fibrosis Foundation, they have online donation tools. He's still, chugging along, and he's a pharmacist now. He's done exactly what he wanted to do. The reason he's a pharmacist is because all of his treatments with his physician and his pharmacist, growing up as a child, he developed a great relationship with his pharmacist. It was a small community pharmacy just like ours, and that made him want to become a pharmacist one day. So that's the reason why he's doing what he's doing, and now he's a hospital pharmacist up in Chattanooga.
I love it. Well, I'm going to put a little plug in here for you. All right. If you are around the Brandon area or anywhere actually in Tampa Bay, Sarasota, and beyond, I would call Bill's Prescription Center. I'm pretty sure you're going to get a lot better service than you're going to get from the big corporate entities. Maybe some happier people too, I'm thinking, answering the phone and actually wanting to help you. So thank you guys for joining us today. I really appreciate you being here. Stay well.
Thank you very much.
Thank you.
Have a good day.
You too. So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.